All righty, guys. Come on in and mute. If you didn't put your information in the agenda, I ask that you please do. We've got a few.
Right at 10, wow, it's 1:02.
Yep, 102.
And we have 38 people in the room. I'll tell you, 1 more minute so we don't have any
Not a problem.
interruption.
If you're just hopping on, third announcement. Today's Lee Rush's birthday. That guy up there in the corner.
Happy birthday.
It's part of my job.
Yeah.
Lee,
Come
how are you
on in,
celebrating?
everybody.
How are you celebrating? How are you celebrating your birthday?
Here with
This
us.
is it. This is the pinnacle of the whole day right here.
Right here with us.
You know, I aim high, you know.
Okay.
No, it's gonna be the weekend. We're deferring the fun stuff to the weekend. You know, when you get a certain age, you know, the whole month kind of is the birthday, you know, there's some kind of birthday spread, you know, so.
Correct.
Well, thank you, everybody, and V, no more. Thank
No
you
more.
very much.
I quit.
Good afternoon, everybody. Nice to have you. We'll get started. We're going strictly virtual today. Number one, to make sure we're all in the same space. If we do a split piece moving forward, we'll do a little better job of capturing some of your comments and stuff if you were online during that last meeting. But also we kind of want to recognize the iffiness of the COVID situation, and we'll be following it closely. We're hoping to have a full in-person meeting in June, on June 15th, and we'll keep you informed. And by the way, if you've been having trouble finding any information coming from us, check your spam. So I mentioned a lot of emails that I used to get from people are now going into spam. So I don't know if that's an issue for you all. Oh, before we go any further, I'd just like to start with a moment of silence. You know, as we hold the families and friends of the people who passed away or were actually victims of the shooting in Buffalo, New York, and also those lost to gun violence in Chicago and across the country every single day. Every single day. Whoever's on, please mute. Thank you, Lou.
Yeah, Lee, I was trying to say we getting a reverb.
Okay, there you go. I think it's because you might have a few things together. But anyway, so back to the moment of silence. You know, we know that trauma lies at the heart of so much of the dynamics around substance use disorder. And we have to acknowledge that our work must encompass a trauma-informed response in all we do. So let's take a moment of silence for about 8 to 10 seconds, please. Thank you. Okay, thank you very much. I'm going to put up the agenda here. Everybody can see it. We'll do a little overview from me. And if when Rep Ford gets on, I'm not sure, I haven't followed if he's on yet. He'll have a few remarks. And it should be convener with an E. We're going to have a recovery residence overview. Kim Schreiner's here with us, from the statewide coordinator of residential recovery services from Super. Dr. Jasmine's going to give an update from CDPH. We have some direct intervention outreach, i.e. street outreach and MAR updates. I know Stefan's on from Night Ministry and Valera's on from Family Guidance Centers. If we have other folks who would like to talk about what they're doing on the street, please use that time to do that as well. And we have some announcements. I know that Dr. Mitter from Malcolm X, I know you have some job openings you want to share with us. And we have Didi Ozabor on from SISTA, Sisters in Sobriety, Transformed, Anointed, and Healed. And if other folks have some comments that they would like to make, I'll stop sharing. And we'll go forward here. Is Rep Ford on at this point?
Not that I'm seeing, Lee. I just began to type in Jonathan Tate's name, but I'm not seeing him either. I'll keep you posted.
So, before I turn it over, I do want to mention, I don't know how many of you were able to get on the May 5th Zoom that we did regarding a visit that we took to New York City to visit one of the above ground operating overdose prevention centers there. The group included Behavioral Chief Jones, Dr. Costalla from Super, Miranda Santillo from Thresholds, Gail Richardson, our lead outreach worker from our outreach team, Marvin Lindsay, the president of the Community Behavioral Health Association, and myself. And V, would you put in the link to the PowerPoint and also link to the video of the meeting? If you want to catch up on that.
I sure will.
And before I leave, I'm going to put in the web or the Facebook addresses for On Point New York City, which runs the two overdose prevention centers in New York, so that you can follow them on Facebook. The director, executive director, Sam Rivera, has been all over Facebook and all over the country giving presentations and being part of panels. And I think it's really good to hear straight from his voice about what's going on there and how they're doing. But it's quite a remarkable story. And we want to make sure we share that with you. So, so I know that Kim's on, and Kim, I know I gave you a time frame, but I think we're ready to roll. And we welcome you to the meeting.
Awesome. Thank you so much, Lee. Let me get a share in here.
And let me just mention, we asked Kim because, you know, we've been a couple of presentations. We've had Vaughna from Phoenix Recovery Services present, and we just want to make sure that we have the most accurate information for you. I know Vaughna gave accurate information as well, but we just want to hear from you, Kim. You have kind of an overview of everything, and we really want to make sure that recovery residents are an active part of what we're doing with the task force. It's part of the continuum of support and care that we want to really establish here and close all the gaps that we can. So, Kim, can you does it work for you?
Yep, I was
Right.
waiting.
You're just waiting for me to stop flapping my gums. Okay,
You're fine. It's your birthday. You can do whatever
Oh,
you
yeah.
want.
All right, careful.
All right, so let me go ahead. You should be able to see my slides. Thumbs up. Okay,
You
cool.
sure can. Yes.
Awesome. So for those who don't know me, hi, I am Kim Schreiner. I am the statewide coordinator for residential recovery services with IDHS Super. All that to say, I do all of the recovery stuff. So especially the recovery homes is my official title, but we'll talk a little bit about just recovery in general. So here is my spider web of what recovery looks like on the substance use side of things. And as we know, it's also holistic, right? So I also have DMH, the Division of Mental Health here. This is most of the stuff that I work with directly, and some other folks like our women's and children's programs, if you know Lisa Cohen, our justice involved population with Matthew Gray, some gambling stuff with Jim and Kelly. But yeah, the rest of this is a lot of my thing. So if anything of this sounds interesting, please feel free to shoot me an email, and I will put my email back in chat in a little bit. But we are going to focus today on these recovery homes especially, but also the Oxford houses and our sober living facilities. So just kind of an overview, the term I use for as an umbrella is our recovery residences. So under that big umbrella, we have recovery homes, Oxford houses, and just what I call sober living facilities. Those recovery homes, those are all licensed by Super. So that means they're subject to Rule 2060. They have compliance monitors that I used to do that. I used to go out every 3 years and say, hey, see how they're doing, make sure their policies are up to snuff, all of that sort of stuff. So they fall under our purview. They also are open for funding, right? So if those folks, you know, if they don't want to just collect fees from clients, they could apply for grant funding because recovery homes is not seen by Medicaid yet. So it is all grant funded, but that is a possibility that people can apply for funding. We also have the Oxford houses. So if you're familiar with the Oxford House Incorporated, this is actually an international corporation that has this amazing model of peer-led, democratic-run houses, right? So they're kind of doing their own stuff. They don't really have full-time staff like the recovery homes do, but we also work with them, link with them, There's a little bit of funding like in a startup loan, but not really ongoing funding. And as of July of last year, we had contracted with Oxford House Inc. to actually expand because we're really struggling. We know that there is such a gap in recovery residences. So we're like, how can we start, right? So we're trying to expand recovery homes. We're trying to expand Oxford houses, and that was part of it. So they're trying to do about 30 new houses a year. They did start up in kind of Cook County, Collier County regions, right? They're trying to, eventually we'll get into Chicago proper, but started kind of the Collier counties first and are moving their way south. So I'm from Springfield, so there is, I'm not as familiar with Cook County myself, but I know there's needs up there. So we're just trying to figure out where those needs are and how we can bridge those gaps. And then we have these sober living facilities. So these are ones that could just be Bob and Joe decided, you know what, we're not doing drugs. We're going to live together. We're going to support other people that are not doing drugs, right? They look completely different all across the state. Maybe they do have policies and procedures like a recovery home, but they're just not licensed. Maybe they run like an Oxford House and they're not Oxford House chartered. Maybe it's just somebody's basement and they wanted to make some extra money. We never really know. They just all look very different, and we encourage them to get trained in how to, provide good services and things like that. But unfortunately, we don't really have too much control over that. That's more left up to the cities. So that's kind of our overview. So jumping back specifically into the recovery homes. So we have 102 total across the state, 2,079 total beds. So that's men, women. There's also some special populations. We have women with children, DCFS involved, folks with HIV, co-occurring disorders, so substance use, mental health, folks coming out of IDOC, and Cook County Jail. Chicago proper, there are 44 homes, and then in the actual just Cook County suburbs, there's 23 different homes. So that's kind of where our numbers are. Obviously, a lot of them are up there, but we know that we need more. There is a huge barrier there. So again, some challenges that we have that we've seen and that we're trying to, come to you guys and kind of partner together to figure out how can we overcome these challenges? What can we do? We've already kind of taken some of the steps due to, we're having shorter stays in residential. So back when I worked in the field, we had folks in there for 6 to 9 months. We're not seeing that anymore, right? You're not in residential for barely 28 days. So people are getting out and needing somewhere to go, and they just don't have recovery capital yet. They're barely, ready to function on their own. So they haven't developed all that capital yet. So how do we increase that in the recovery homes? Because that's where they a lot of times will end up. We also have a lot more complex clients. Co-occurring is like something like 70% of folks have co-occurring substance use mental health disorders. So that's a real big challenge if you don't have that background in mental health, or if you just haven't had training on it yet. We're also seeing a lot of medical issues. Maybe they have diabetes and they need meds. Maybe they have MAR, which is kind of our special population over here. Maybe they just don't know, how do we deal with those? We don't have nurses on staff. What do we do? And then another one is like sex offenders and other, like arsonists and things like that are coming out of DOC. Like, where can they go, and who wants to house those people, and how do we do that comfortably? The other issue with MAR is it's been a challenge to figure out what houses accept it and what types. And is that their policy, and what's actually really happening? So, oh yes, we accept them all. And then you try to refer somebody and they're saying, no, we don't take that, or not that time, or not, not this one. So it's been a real challenge there, but we have been working on trying to solidify what is actually happening in reality. So with some partnerships that we have, I know I saw Vaughn on here. I think I've seen a couple more folks that have been on our learning collaborative. So these were kind of born out of the idea that there needs to be more training, right? Recovery navigator or recovery home operators they're in CRSs or CRSs or CPRSs, which are all these credentials that are not clinical. And with that, maybe they do need a little bit of extra support and technical assistance and just learning and collaborating with each other. So we have started these learning collaboratives. They started last year. They're kind of on a hiatus right now until we get a little bit more staffing going, but planning to start those up in fiscal year 23, so in a couple months here. Those are try to do like a 15-minute didactic training on whatever topic somebody has brought. And then the rest of the hour is spent on questions and answers, brainstorming solutions, things like that. We also have a lot of different trainings that are hosted by Super. So those could be, we just sent out one that was like on harm reduction. There's other ones on some MAR stuff going on. We just have some regular, what is recovery? What does that look like? How do we deal with that? So those are some things. Also technical assistance, I'm always available. We also have IACE, the Illinois Association of Extended Care, that is our Illinois NAR affiliate that can sometimes do some technical assistance. We also have the helpline. So if you're not familiar, the Illinois helpline, I can throw that link in the chat in a bit. And they can help with referrals, they can help with resources, they can help with all sorts of stuff like that, as well as our recovery navigator. So I'll go in a second a little bit more into this with the details, but basically this is a collaboration with, I think, 9 recovery homes in Cook County, trying to increase referrals and again, linking with resources and being like a one-point contact of like, I can call Jillian and she is going to get me somewhere, right? So she has a list of all of these places, has direct contact with all of them, and it's been really helpful. So we've had about a 25% success rate so far. It's just a pilot, but looking to potentially expand it in the future. So I'll give you, and I'll jump back to this in a second here, but so this is their information and the ones that are included. So some familiar faces on here. But this is really, really helping with those partnerships. I'll run back to my other slide here. So some of the collaboration pieces and how do we bridge gaps and barriers and things of that nature. So I'm not out at the field anymore, so I don't know what's going on, right? I've been out of the field for years and years at this point. So you guys are kind of my eyes, my ears, all of that. So anything that you're seeing of like, hey, I'm struggling to place this person with this concern, or I'm having trouble with whatever regarding recovery, right, with these folks. I don't know unless I don't know what I don't know. So please, please, please always feel free to reach out to me. So communication is a big thing with me. That was one of my big pushes in getting this role a couple of years ago was I want to be that person that people can contact it, be it providers, be it clients, whatever. If they have questions, they can always reach out to me. And then funding opportunities, this has always been a struggle with the recovery homes because we will fund them once they're up and running. But how do we get started? Not everyone's going to say, oh, here, this person just donated a house to me so I can open a recovery home. So if you guys ever have any ideas of funding opportunities, if you're aware of anything that comes out, there was just one about, I think it was from HUD that did one to kind of do some like capital development funds, but that's something we can't pay for. So if anybody ever knows about any of those, to share them, I can share them with my networks. I do have a listservs of all of the recovery homes, all of the recovery partners, all of that. So I would love to share and big on sharing. So I will copy all of this information, at least the number, into the chat for you guys, as well as my email address. And as for slides, that's all I got besides my questions. So we'll go ahead and end this. Oh. Helps if I press the right button. There we go. All right.
Thank you, Kim. If you have any questions, put them in the chat or do use the raise your hand reaction.
Yes, please.
Will you be able to send your PowerPoint out?
Sure. Do you want me to send it to you?
Sure.
Or?
Yeah, send it to me and we'll send it out as a recap.
Okay. Yeah, absolutely.
Peter has his hand up.
Hey there, Peter. I see your hand up. You need something?
Hi, thank you. Yeah, thank you, Lee. Yeah, my question is there a directory of recovery homes in the state of Illinois that has like name, addresses, phone numbers, or at least addresses and phone numbers?
Yep. So I will put, it's all on the helpline. They have all of our licensed recovery homes, at least on there, and the Oxford houses. The issue with the sober living homes is we don't know about them, so if we know about them, we say get registered on there, but not everybody does that. Not everybody wants that advertisement. But yes, all the recovery homes are on there, so I will put the link in chat for that as well.
Awesome, thanks.
Thank you.
Lee, we do have a question in the chat. Do we want to get to that now or
Sure.
move on? Hey, Albert, who says, can you use a rental property to open a sober house or recovery support facility?
Sure. I mean, the only things that I would say is making sure you're following all your zoning for your city, and county and all of that. But there are ones that they're rented. There are ones that people own. It just kind of depends how you would like to do it. So, and we can talk more, like I said, I'll throw my email in chat. So if you do want to, play it out a little bit more, we can talk about that too.
Derek Ocho wants to know, is this list different from the super recovery home list?
So Derek, I'm not sure which list you're referring to. We used to have the recovery, what was it called? The Recovery Residence Registry, because we like RRR, I guess. I don't know. That used to be on the super website. It is horribly outdated because we did go to the helpline to host it all, and they actually update it regularly, more so than we do. So I don't, if that's the list you're talking about, if I'm thinking of something different, let me know.
I got a hand up, Vana Hernandez. Hey, Vana.
Hello, everybody. Thank you so much, Kim. Great presentation. So first, I want to have a disclaimer. So last meeting, I mentioned that Phoenix was the only recovery home in Austin, and that's not accurate. What I typically say, and I've said it a gazillion times before, is that we're the only state licensed recovery home for men in Austin. And Kim can confirm that. So I apologize for that. But to that point, Kim, is there, because with the sober living homes, we don't always know who they are because they're not registered. Does Super have plans to kind of in some way bring them into the fold, because it maybe that's a better environment for somebody, or suited to one person than the next, and we want to be aware of all of them, which was, my point last month, is that we need more. Like you were saying, there's only 102 in the entire state. That's not enough. For those of us who are boots on the ground and doing the work, we know we need more. So what are Super's plans to kind of bring those non-licensed facilities into the fold?
Absolutely, Vana. So I would love to be able to spend hours with each of them, right? If you know me, like that's my bread and butter. Unfortunately, I don't have the capacity to do that at this point, but if I get a list of them, I would love to start, like I said, we do the Recovery Home Learning Collaborative on every other month. I would love to do on the opposite months, a learning collaborative for those sober living facilities, the ones that are not yet licensed. It would look a little bit different, like how do you get licensed? What does funding look like? All those sorts of different things. And then maybe we'd come together with the actual licensed ones to then, collaborate and brainstorm on those too. I would love to do that. But again, I don't know what's out there. So if you guys have ones in your area that you know about, of like, hey, is this licensed or is this not? I just know we send people there. Feel free to send them my information or vice versa. And we can definitely get those conversations started. Again, I love those provider relationships. So, even just building those and knowing that, having them know that, hey, if I do want to go this route of license, I do have a contact person.
Really good. I think we have one more hands up, Aisha Muhammad. Then we're going to move forward from this one. Thank you so much. Great presentation, Kim. Aisha Muhammad, are you there?
Thank you so much. Thank you. Great information. Just a quick question. Is there a database that show a list of open beds daily? I know at one point sometime during this field, we could access that. Is there a way to know what open beds are available in recovery homes daily?
So part of the pilot, that Catman Recovery Navigator pilot that I was talking about, is through Catman Capacity Management System, or the HRI system, also owned by the helpline. Part of it is capacity management. So they have a wait list, they have that sort of stuff. We haven't fully activated that side of it yet. And we're not sure, we're kind of feeling it out if that's the way we want to go, because a lot of people aren't really keeping them up to date. Like they have access, but then it's not updated. So what good is that? There is also one for the Oxford House vacancies, and I can go ahead and put that in the chat. But again, it's all dependent on the different providers to keep it updated, and I don't really have a good carrot to hold out to get people to keep things updated, unfortunately. We encourage it, and it's required under grants for like residential and MAR, but again, it's not always followed. So
I think that would be excellent for every day. And either, and I'm from Haymarket Center, for us to be able to say, hey, we have 5 beds open here, 3 beds open here, where someone can be able to access that daily to be able to, you know, place those people in need in those beds.
Absolutely. I mean, from my point, it would be fabulous. The only kickback we get is from some providers that are just like, they're at capacity, they're over and above their limits of what they can do in a day, and signing into a website to update it is a challenge. So, but yeah, I get you. I appreciate it.
Thank you.
Thank you
Thank
so
you.
much. Okay, Lee, we can move forward and anyone else has questions.
Okay,
in the
well,
chat.
thank you. And then you got your information in there. And I just want to mention, can you mention Officer Capers' comment there? She has to jump off. We always love having her involved in our outreach, and also thank you for coming today. Do you see her post in there?
Let me see. She's put something in the chat. Oh, this one from Latanya.
Yes.
Hello, everyone. Thank you for inviting me into the meeting. She says she's not able to stay into the meeting. She wanted to make sure that we all knew about Operation American Hustle. Mayor Lightfoot and Superintendent Brown will discuss it in a press conference May 20th at 1 p.m. Community volunteers are welcome to participate in the block cleanup 10 a.m. to noon. There will also be resources in the job fair June 11th, 11 a.m. to 5, Madison and Hamlin. She says for further info, you can contact the CAPS. There's the number there and an email address. And
Thank
she had another item, the 11 district faith-based and anti-violence strategy meetings are held the second Tuesday of the month at 11 a.m. hybrid and in person, and all that information is in the chat.
All right, well, thank you. And, you know, Officer Capers has been out for I think a couple years now, comes out when we're out doing our street outreach. So it's always nice to have her involved.
Thank you so much for leaving all of that. I'll make sure we get it
Right.
over in our follow-up.
Great. And, okay, so I see Dr. Jasmine from CDPH is here. So we'd like to, welcome you today.
Oh, yes. Thank you for having me. Can you share with me the
Sure.
capability?
Absolutely.
Yes, ma'am. I should have.
I'll keep it brief today.
Oh, we're.
All right.
Gotta scroll through a lot of people here.
I know we've got almost 70 folks on. Thank you all.
Can you give her a co-host?
I can
You
try.
find her before I do?
Very possible. Let's see here.
It might be towards the bottom.
Oh, yeah. Well, no, you're actually towards the top.
Let's see.
Because you're speaking. Thank you. Thank you, everybody.
Oh, he's good. Co-host. There you go, Dr. Chad.
Thank you.
Thank you. Welcome.
Okay, let me know if you're able to see the screen.
Yes.
Dang it. Great.
Perfect. And so since we're back online this month, I just wanted to briefly give a 2-slide recap of xylazine. So that's the topic I talked about during our in-person meeting last month. And just to make sure those who weren't able to attend last month, they also have this information. And so xylazine is a non-opioid drug that's FDA approved for veterinary use, and is used as a muscle relaxant, a sedative, and a pain reliever for animals. And we've been seeing in April, there were 2 reports released that looked at xylazine nationwide, and also specifically in not nationwide, statewide, and also specifically in Cook County. That showed that there were increasing numbers of people who had died of overdoses, who also had xylazine in their system. And so just to make you aware, it has an effect that's similar to opioids, where the person can be drowsy. Eventually, the person can stop breathing if they have too much of this drug in their system. Some of the names are Trank or Trank dope. And what's important, the important takeaway for this information is that even though it's not an opioid, it's good to know that opioid reversal agents, so like naloxone and Narcan, they're not effective against it. However, because we know it's being mixed with other opioids like heroin or it could be fentanyl as well, we still recommend people use Narcan and naloxone if they encounter someone experiencing an overdose, because it might counteract or reverse the effect of whatever opioid is in the amount of drug the person's using. It's just, you might see the person may not wake up as readily or as quickly. We sent out a HAN alert to providers so that they also keep that in mind when they are trying to revive their patients. And we still advise groups like yours to make Narcan readily available in the community. And then now, just giving a quick COVID update. So right now, our community risk level is medium. On the slides, you see are two of the different metrics. So on the left side is the old metric system for us determining what the community risk is. And on the right is the new metric system. So on the left, we had 5 different inputs. We talked about confirmed cases per day, hospitalization rate, deaths per day, and tests conducted per day, and test positivity. A few months ago, the CDC revised the metrics they would consider to determine a community level's risk. So that's the new number of cases, the new COVID-19 admissions for every 100,000 people, so the admission rate in hospitals, and the proportion of staffed inpatient beds for COVID-19 patients. Regardless of which metric system you use, the community level risk is still medium. And whenever I talk about the community risk, I share both because sometimes a question arises where someone may also ask about, okay, if the old system was used, would we still be at the same level? And so what a medium risk means is that right now we're strongly recommending masks when you're indoors. May have heard in the news that there's a lot of litigation going on about whether or not a government can actually mandate the mask, but the CDC still supports the use of masks. And I'm just reiterating that message. It's okay to wear your mask. And I personally would recommend you wear your mask, especially we're out of that low risk. We're now in medium. So we want to have every measure in place. Yes. If you haven't been vaccinated or know clients who haven't been vaccinated, I do encourage you to share this information that now is still a good time. It's not too late to get vaccinated. Also in the news is baby infant formula shortage. And so just to counteract some of the misinformation that's going around for people to cope with this shortage, we created this infographic. So we're hearing reports of parents diluting formula. And so that is very dangerous when giving to infants, especially newborns. Their electrolyte system is very delicate. And so by diluting the formula, you're giving more water than it is appropriate for a child. And what that does is increases their risk of developing this condition called hyponatremia. So their sodium levels may go too low. And we find that to be very dangerous because that can cause seizures in the newborns. So we ask not to dilute formula, avoid homemade formula. Not all of the recipes that are found online is nutritionally balanced. So we ask parents avoid homemade formula. Use of substitute formulas is fine, especially if you're a newborn, you know that the child doesn't have any allergies to any kind of no allergies. If the child does require a special diet, do seek help from your provider. But also the WIC offices do have resources to help you navigate what could be an appropriate substitution if there is a need to be very specific with the type of formulas that's given. I'll share this PowerPoint, and the link will show the different WIC offices available in the city. And also the federal government, the Health and Human Services, they also have additional resources that can be shared with your clients. So I always give this announcement. So our Chicago Public Libraries, we are slowly reaching all of the libraries. So right now we have, here's 14, that was the initial rollout, 13 additional libraries also have Narcan available. I'll get you the full list after the meeting. So it's just making it available for anyone to walk in, and we really want to encourage everyone to carry Narcan or naloxone with them, regardless of whether or not they're aware of someone who uses drugs in their lives. And then this mental health resource page, if you visit mentalhealth.chicago.gov, this is something where you can type in the address of your clients, and it will tell you the different mental health facilities and organizations closest to where they live that will see anyone regardless of their insurance status, their ability to pay, or their citizenship status. Additional resources on this page include Chicago residents sharing their stories about how receiving mental health services really had a positive influence in their lives. And I mentioned that because here, this is Mental Health Awareness Month, the month of May. And so there are 3 different avenues in which the health department really tries to break down public health information in a digestible format. And so one, Dr. Arity, she's been broadcasting her Facebook and Twitter show since really the beginning of the pandemic. About a year ago or a year and a half ago, we had Dr. Luna had a version of that on Facebook and on Twitter. Mainly catering to those who are primarily Spanish speaking. And then last month, Dr. Taylor's Table has rolled out as an IG live show. And she'll speak to topics in addition to COVID, but different health related topics specifically that are a primary concern of those in the Black community. I'll be on tomorrow. This is Mental Health Awareness Month. We'll be talking about a mental health topic. And so I encourage you to tune in or watch the replay. And that's it.
Wonderful. Thank you so much, Dr. Jasmine.
Yeah, you're welcome.
Are there any questions?
I am not actually. She's just that thorough as usual.
Oh, and I see the helpline was added in the chat. So yes.
Someone did that, yeah.
Okay.
We still got folks coming in. Come on in, folks. We've been started for quite some time. So Dr. Jasmine, you have your information in the chat if anyone else needs to reach out to you.
I'll do that.
Excellent.
Thank you so much. And thank you to the CDPH team. I don't know if you all know this, but on the 4th, usually on the 4th Friday at 10 a.m. Is it 10 a.m., right? Doctor, yeah, 10 a.m. Yes, yeah, okay.
It's 10 a.m.
Yeah, there's an hour-long meeting of the West Side SUD providers, sharing key information, and also the heat maps that allow us to look at where the preponderance of EMS calls for overdoses are occurring. Been very, very helpful and continue to get more detailed as we move forward. So I really appreciate that. And I know we have Taylor Wood on, but Taylor, and he's the drug tester, for lack of a better word, for CRA, Chicago Recovery Alliance. But I'm going to move that your report a little further down the road, Taylor. If you can stay on, that would be great. And thank you, Dr. Jasmine. And let's move on to the next piece. We've had a very active collaboration out there doing street outreach or direct intervention outreach, and also now we have vans that are able to create MAR induction. on the spot. So I want to get an update from some of the folks who are out there doing this. We have Stephen Karuba from Night Ministry first, and then Family Guidance Centers, Blair Butler's here. But if you have other folks, we have other folks on here that want to share, please do. So let's turn it over to Stefan.
Hey, thanks, Lee. Appreciate it. Is there an echo going on, or can you hear me?
I can hear you okay.
A little bit of an echo. Try
Little bit.
again.
There we go. I think that might help. Let's see.
Perhaps two different devices at once.
How about now?
There you
That sounds like it fixed it.
Yeah.
Hey, everybody. Nice to see everyone on the call. Thanks for inviting me. I'm just giving a quick update on some of the things that we've got going on at the Night Ministry. Full-time nurse practitioner there. One of the good news is we've, like everyone, we've had a little bit of turnover on the medical front with our practitioners. And as of the first week of June, we'll be back to full staff. So that's going to take a little pressure off and maybe allow me to get a little more sleep. So that's going to be welcome. One of the things we're rolling out on the west side this summer, we started already going out on both our shifts on Tuesday are designated for outreach on the west side, following the 911 hotspot data that we alluded to earlier. I know West Side Opioid Task Force is doing their days as well. And then besides Tuesday, our Saturday run is also designated on the west side for that purpose, bringing the resources that we always do, which is medical care, case management for IDs, housing help, and then the support for the treatment and harm reduction options that we have going. So what we're also trying to expand that in is to include a little bit of the drug testing with CRA, doing some co-outreach during those times, with the hopes of really giving us the information of what's going on in those hotspots, which will help us to tailor our messaging and our education as well as the services we provide. So that's really exciting to me. I think we're going to really have an impact on the overdoses this summer doing that type of work. And then another thing we're working on is we're coordinating with HOST to be a collaborator with us and to be an opioid treatment provider for us, to go ahead and try and be the third van in Chicago, bringing out Suboxone, methadone, and the monthly injectable to treat opioid addiction. We've had some meetings with DEA and it's all positive. So I think we're going to have a proposal in for that program in the next 4 weeks or so. And hopefully, I think the other vans were able to go live after about 9 months. We'd like it to maybe cut down since they blaze a trail for us, but 6 to 9 months, hopefully there'll be that third van out. Our hope is that we'd be able to collaborate with those vans and be able to share enough information that we could treat each other's patients if the patient isn't able to follow up at their original point of contact. So that's pretty exciting development. Also, there's a little bit of momentum being gained in the outreach community now to put a proposal together to invite the 2023 Street Med International Symposium to Chicago in the fall of 2023. That would allow us to highlight and showcase some of the great work that's being done by all of our different outreach providers, as well as create some more contacts for us and just keep the momentum going for all the great work that's going on. So that's kind of in the works right now. I think that proposal has to be in by June. So we're trying to get partners together who are willing to participate and kind of shoulder the burden on that organizational side of that. So if anybody is interested, anyone's organization wants to participate or see what's up with that, I left my email in the chat. Go ahead and shoot me a note, and we'll include you all on the different planning emails that are going to be going out. So yeah, that's some of the news that's fit to print from the Night Ministry. Thank you for your time.
Thanks so much, Stefan. That's exciting. And yeah, let us know. We'll keep it close on the symposium. That'd be wonderful to have a showcase in Chicago to let them know what's going on, all the great work. Any questions for Stefan?
Not that I'm seeing in the chat
All
box.
right. Well, thank you. And keep up the amazing work you're doing.
Great work, Stefan. Thanks a lot.
So next up, we're going to bring Blair Butler from Family Guidance Center. Blair's been, I think you've been kind of operating the MAR van or one of them. So welcome to the task force.
Thank you so much, Lee. Nice to meet everybody today. It's my first time on the call. So I can just give you guys an update and let you know where the MAR van has been and where our partnerships are currently. So every Monday, we have a tentative schedule and we are at Methodist Hospital. We receive patients off the detox unit that are interested in dosing on the van, receiving their health and physical by the doctor and being assessed by the outreach workers, doing screenings and, seeing what services are appropriate for them. Then we're also, doing referrals and getting them transportation, even if they're not going to go directly to family guidance centers. We do support them to go to any other referrals and any other MAT or MAR clinics in the Chicago area. On Tuesday, we have a solid schedule with the task force. I'm super excited about that. We're in the community, reaching the clients to where they actually need us the most, like in the West Side area, taking the brick and mortar in the van and like just getting them out into the field. I feel like that's successful. We've had some really great days. 5 patients, even when it's 2, is still successful, even if we reach those people out in the field. On Wednesday, we go to Franciscan Outreach, and we're also doing the same thing. The van comes with an armed officer, a physician, and the other clinical staff, including my staff doing the screenings. On Thursday, we have a new partnership with CDPH. We're really excited about that. We went for the first time last Thursday. I got to meet the center director, a lot of therapists, the community, also other community outreach specialists that were working in the area. So we'll be there every Thursday from 10 a.m. to 12. And on Friday, we're back at Methodist. So far, the van has serviced 96 clients, potential clients. When I say service, they were actually dosed on the van. They received methadone. We also have Suboxone available on the van. And they were given referrals and transportation if needed. And then we follow up with them to continue their recovery and care if they do go to a family guidance center clinic. So that's basically my full update regarding the van. If anybody has any questions. And we did actually go live for the MAR Now hotline, and I just received confirmation that we got our first 2 calls yesterday. So I don't have any other updates about that because the meeting is going on while this meeting is going on. So I could give you guys a full update about if those calls were successful on the hotline and how they continued on through that recovery and referral process.
Fantastic. Thank you. The more the merrier out there. That's fantastic. Thank you. There's a question here. If a client doesn't live near a family guidance location, you refer them to an OTP closer to their home.
Yeah, so I have outreach workers that are dealing directly with the clients when they're getting their physicals and being assessed by the nurses. So they'll sit down and have like an actual intimate conversation with them and ask them like, hey, where do you want to be referred to? If we give you transportation, is there somewhere in the area that you would like to go to? And then we would find that contact information and then call that facility, see if they're available, if we could actually help them and assist them with their referral needs. So yes, that is possible.
There's another question here from Vonna. Are the vans providing referrals to recovery homes if they choose not to go to residential treatment?
I believe so. So if, like, say, for example, if the client is interested in going to Mantino, which is our residential site that I also manage on a facility side. So if they want to go to that location, we offer a livery service and would literally drive them to that residential location to start recovery. But if it's like outside of FGC, we would give them like a bus card. We would call and see how we could assist, but we wouldn't actually be able to take them there with our livery service. It would have to be FGC, but they're definitely able to go and we can assist them with setting that up if they needed it.
Okay. Thank you. Are there any hands up?
Looks like
I
Dr.
have
Jasmine
one.
has her hands up.
Yes, I also wanted to mention for the Family Guidance Van that's on 641 West 63rd Street. In addition to CDPH, it's also a partnership with Howard Brown and UIC Mile Square.
Fantastic. Fantastic. Thank you. Well, nice to meet you, Blair.
Nice to meet you as well.
Thanks for having you. First time. Welcome.
Yeah, that's
Thank
great.
you. Appreciate it.
And I see I thought I saw Dave Jimenez, and I know Albert is on as well. Is there any update from COIP?
Yeah, I'm going
Would
to
like-
ask Albert to provide it. He joined the meeting for that.
Excellent.
And I think Mark Hartfield may be on the meeting too. He can talk about the 10 project as well as our mobile MOUD program.
Okay, great.
Hey, everybody. So my name is Albert. I'm the clinical services coordinator for our mobile opioid use disorder mobile van project. And so for right now, we're out 6 days a week. We spend 3 days on Van Buren and Pulaski next to Save a Lot on Mondays, Fridays, and Saturdays. And Tuesday, Wednesday, Thursday, we're at Chicago Avenue in St. Louis, which is a hot spot. And we're offering some of the same services that was previously mentioned by Blair and some of the other people. So we do Suboxone in addition to our harm reduction services, which includes HIV and hepatitis C rapid testing. We have food donations, and then we're doing a lot of COVID testing and vaccines and wound care. And I think we're supposed to be getting some, I think we're supposed to be getting methadone on a bus, and actually, instead of writing prescriptions, we will be able to provide Suboxone. I think we're just waiting on DEA related things to clear for us to do that. Yeah, and on Mondays and Fridays, we do have like a sobriety tent that we're working on with the task force.
That's great. That's 11 to 4.
Yeah, it's the sobering tent is a pilot that we may have mentioned in the prior call that we're doing in collaboration with the West Side Task Force. It's a pilot that's on Fridays and Mondays. And we're in our second month now. We had an initial kind of issues like the 10th blew away the first, second day. So we had some kind of stumbles initially, but it's been going pretty regularly. And we have been seeing people that are using it to recover, from their opioid use. So we're collecting some information on that, as well as the variety of other services. I know Prevention Partnership and Westside have staff that are helping us man the tent that provide overdose prevention education, provide fentanyl test strips. They work in tandem with our own harm reduction workers to provide syringe services for folks that need that. And then, it's linked to the mobile MOUD van. So the idea is to create an environment where people are safe, but also where they're aware, of other recovery services that are available. So.
We also have a recovery and support person out there too that is helping linking people to like outpatient treatment and stuff like that. So
that's great. Thank you. And then, oftentimes when we refer to the West Side Heroin Opioid Task Force being out there, it means the street outreach team. You all are here, are just kind of de facto members of the task force. We encourage everybody to come and share. But we are talking about the street outreach team that Luther Sias, our outreach director, and his team, are out there pretty much 6 days a week. We have a schedule that comes out. If you're not getting that, please let us know. Part of what they're doing out there at the sobering center is going around in the community and letting people know that it's there, and so people can avail themselves of it. So anyone else from the outreach side of things want to mention? Lou or any of your team? Gail, anybody else want to chime in?
Both Lou and Gail are on, so feel free. Probably got a hand up too. Matt Rago.
Yeah, hi. I'd like to introduce myself. My name's Matthew Rago, and I represent an organization called Live for Lally, a 501c3 nonprofit specialized in harm reduction services. For example, naloxone distribution, fentanyl test strips, safe use and sex supplies, personal items and toiletries that kind of are meant to alleviate some of the socioeconomic stressors that are underlying that might embolden substance use or alcohol use disorder. And our organization has recently received a grant to expand our services into the Cook County suburbs. So we're looking to collaborate with organizations where there's participant overlap, especially when there's co-occurring disorders that are present. So we're still in the embryonic stages of establishing this presence in these new regions, but we would love to learn from the organizations that are existing in those regions and learn about the demographics and communities that you've worked with and how we could assist your current efforts. So, if any way at all. So if any of the, organizations that are here today are currently stationed in the Cook County suburbs, we'd love to hear from you. We'd love for you to, drop your email and I'll reach out to you and see what we could do to, assist assist what you're doing right now. The great thing about our service is that we have, similar to Blair and what Albert was saying, we have a mobile outreach truck that offers the free supplies, and all the participants are protected by legal immunity. We hand out a card where if they, do use, for example, the safe use supplies, cop pulls them over, they can't be arrested. So we'd love to hear a little bit more from you guys, and I'll drop my email right now. And yeah, that's it out of me.
Thanks a lot, Matt. Love Live for Lally. There's a lot of love in Live for Lally. So
That's for sure.
yeah, thanks so much. All right, anybody else from the outreach side of things? We have a very robust group, and this wasn't happening in this cohesive and coordinated way even about a year ago. So there's everybody stepping up, getting to know each other personally and trusting each other. And I think that the folks out there that we interact with can see that, and hopefully they feel that they're being cared for, and hopefully a continued dialogue with them, so we make sure that we are doing the right thing with them as well. It isn't this that we're serving them, we're working together with them to create a better environment out there. Let's move along. We have about a half hour left. We're right on time. And I'd like to bring in Dr. Mitter from Malcolm X. You have some job openings that you'd like to share with us?
Hi, Lee, and everyone. Thanks for having us back. Actually, not job openings, but to just give you some great updates about our program and some courses that are coming up. I think the last time I was here, I talked with you all about the Opioid Impacted Family Support Program grant that Malcolm X now has. That is run through our community health worker program with a focus on SUD, OUD impacts. And with that grant, we are able to support tuition and also life expenses for students to go through that program. We recently received a braided funding opportunity through the state, through IDHS, to create a CPRS credentialing pathway for students. So we are seeing this opportunity as kind of an extension of our OUD community health worker pathway, and we are going to be ready to enroll students in that and hopefully usher them through to credentials in that profession this fall. So we're really excited to have an impact on the workforce. What we understand is that there is a real shortage of recovery coaches, recovery navigators, and similar roles, as well as an infrastructure of management of those kinds of roles to really build out what is needed in that space. And so I think the state put funding around some academic institutions to really usher people through those pathways to credentials, because that's what we're really good at. So very excited about that opportunity. Associated with that opportunity, we have some job openings. So we do, Lee, you're correct on our side. We are looking for several different roles of people who hold CRSS, CPRS, or similar credentials to help us to develop the curriculum and to potentially teach. There is a lot of flexibility in some of those roles. So it's not necessarily on-site roles or things that you might be able to do in a flexible way. And my colleague Veronica Sack is going to drop those links to those jobs in the chat for for me while I'm talking, but we have a role for adjunct instructor. We have a role for curriculum developer and instructor. We have a role for recruiter and for grants director. I'll also, when I stop talking, put my email back in the chat. So if anyone is missing any of this information, it can you can reach out to me or Veronica. And then the last two more things I would like to say, and we'll drop this flyer also in the chat and send it out via email as well. On June 13th, 15th, and 16th, we're holding a 3-part series on expungement and sealing of criminal records. We know a lot of our students get impacted by this when it comes to working in certain environments. This course is absolutely free. We'll be providing some food or at least refreshments, depending on how many participants we get. I may be able to provide full dinners on those nights. But we're looking forward to that. We have an attorney from the CTM legal group that's going to be with us conducting those workshops. And again, totally free of charge. And then the last thing is we are open for enrollment. Our fall cohorts will start the very end of August, and we'll be running a full-time 16-week cohort through our CHW program, which leads to our CRSS, CPRS pathway. And then we'll also run a part-time cohort, which will be over the fall and spring semesters for someone who might want to take it a little bit slower in pace and so forth. So very excited, loads of financial support to put around folks that are interested in this work, and I'm happy to talk about this with anyone who's interested. If you do have jobs available in the recovery space, we are looking for partners to hire our students into apprenticeships. Apprenticeships are just really synonymous with jobs, but a job that comes with a very vetted candidate who has a really robust onboarding plan for their first year of employment. And so very excited to potentially engage with you in a lot of ways. You all have been a wonderful group. I know Vana has been amazing connection in the last few months since we initially met. So, and I believe Carlos is on the call. We've connected as well, and others of you, I definitely recognize your name. So yes, please reach out with any other questions. Veronica, do you have anything else you'd like to add?
I think that's everything. I'm looking for the other flyers to add on here before I hop off, but we can definitely send out the links for the positions too. I think I just looked and they just expired, but we'll have those updated momentarily.
Perfect.
Thank you very much, Dr. Committer. Thank you very much. Excuse me, Takara, did you get your question answered?
Yes, I sure did, and I'm excited. Thank you so much.
Great. I just want to let you know, Doctor, that you know, we have brilliant minds, and very practical minds on the west side here that you can pick our brains anytime. In fact, we really love to be able to give input to some of what programs are so they can actually be realized on the street. We definitely recognize the shortage, and we really want to build a bench, especially from folks who know and live on the west side. So we're all behind this. Appreciate it.
We really appreciate that too. And we know you guys are, we feel it. And so we're definitely here to do our part and contribute in the way that we can as well. So anything we can do for you all from our perspective, please reach out. We're moving and shaking at Malcolm X, and we love innovation, and we love pioneering and trying things that really make a community impact. So this is really dear to our heart.
Thank you. Thank you. So we're moving on. Thank you very much. And
I
you've got
have
a lot
a
of
question, Lee.
Oh, sorry about that.
This is Fania. I'm a graduate of the Malcolm X Community Health Worker Program, as well as with the Westside Heroin Opioid Task Force. I have a question. When you guys become credentialed, will this block people who have records to becoming part of the program? Because I think it's a great career for those who might have been formerly incarcerated to have a pathway to do something with their lives. So that's my question.
Yeah, absolutely. Wonderful question too. From our side on the academic side of the house, we do not have restrictions about who sits in seats for academic programs. Typically that barrier is on the employment side. So it kind of depends, although this field of work is much more open, I think, to those opportunities, maybe with some parameters in place about length of time since, you know, potentially an arrest, conviction, et cetera, those kinds of things. But the expungement and sealing, we know if you can get something off your record and you have the support to do it, might as well do it. It frees up a lot of impacts that it can have in your life. It is also an objective of the grant from the state to host this and really try to, you know, move some progress in that direction as well. But no barriers from our side.
Does that help, Fania? Okay,
Yes, thank you.
We're really excited to have Fania joining us, and that, you know, she's the with her experience at you know, at Malcolm X and her experience with us, so it's fantastic. Let's move on. Thank you very much again to Didi Ozabor from SISTA, all the way from LA.
Right, yes, I'm going to be quickly because I do have to catch a flight. Hello, everyone. Thanks, Lee, and happy birthday again to my friend Lee. I am a West Sider and I provide services currently at Haymarket through my organization, SISTA. But what I wanted to share today, I mean, I normally share about sister stuff on this Zoom call, but what I wanted to share today was that I work very closely with my church in outreach ministry. I'm the director of the prison ministry team there. And up until COVID, we were having every year what we call a Healing Our Village type of an event that we would put on and showcase different things. But this year, we're going to have it in person, live again, back at the church on June the 11th. And I'll type all that info in the chat from 10 to 1. And to piggyback on what Doc just talked about, we too will have 3 legal aid clinics there. It's what, the Greater Chicago Legal Aid, Cabrini Legal Aid, and the Legal Aid of Chicago, to talk about not only just expungement and concealment, but everything else from housing, cannabis, you know, what that looks like, you know, in terms of being legal, the legalization of it, where you can smoke it, where you can't. In addition to that, we've partnered with Friend and Meridian, who will come out and bring a mobile unit so that they can do, now, in going back to the legal stuff, just, you know, so that people will know it's only resources. So they won't be able to do the actual expungement or the concealment there, but they will provide the resources and have them to set up an appointment to come and get further information. And for those that can bring their rap sheet, it would be great, but if not, they can still provide resources for the individuals. We will have mobile unit out as well on the street to deal with health and wellness, to do assessments, to talk about how they can get additional appointments to come out and have additional health care done at various facilities. Now, granted, it's on the south side, but we're targeting citywide. Mainly, it's a community fair, but we're looking at formerly incarcerated and those that are gone through recovery, you know, and substance abuse. So, but it's open to the public. I don't want it to seem like it's only going to be just for that demographic population, but that's what we're really trying to provide the resources for, because with their issues, it's hard for them to get various resources. In addition to that, we will have Safer Foundation to join us on that day to talk about job readiness, things of that sort. How do you, you know, set up an email address now that you have to do a lot of applying for jobs online, to assist, you know, people in that nature that are not familiar with working with computers and whatnot. I'm grateful to have the West Side Task Force will be joining us, along with other agencies that particular day. If people want to get their vaccination, people will be there to do that as well. and any other, resources we can provide that day. It's about 14 partners. I'm going to put the church's website address in there, so you can go on the website and you can scroll down to where it says Heal in Our Village, and you will get all the lists of the various partners that are going to be present. I will also put the phone number as well as our extension for the prison ministry team. So if you have any further questions, you can reach me that way as well. And Lee and V know how to reach me directly. So that's my spiel, my soapbox for the day. And it's
Thank
good
you so
seeing
much, Dee
all
Dee.
you guys. Thanks, Lee.
All right, take care, travel safe.
Thank you.
Safe travel.
Okay,
Thanks,
so
Lee.
we're moving towards the last 20 minutes, and I do want to bring in Taylor Wood, who is the CRA person who lets us know a lot about what the drug testing telling us. Taylor, do you want to give us a couple minutes, or do you need to be, I think I just gave you a co-host thing if you have anything to share. No, I didn't share that yet. Sorry, I can make you co-host.
No worries. If there's any way, there I am. Can we, let me see if I can make it. Can we share the screen for the Taylor Wood that doesn't say CAM in parentheses?
Yeah, okay.
Oh, okay, you have two separate ones. Got it.
Are you doing that, V?
I'm trying to make sure I understand. So Taylor Wood, I have two of you here, and you're needing to be
I think I gave the wrong one. While we're trying to get that together, Frida, did you want to mention it and say hi to everybody and kind of tell them what's happening, or?
You should be good to go.
Thank you. Thank you, Lee, and also happy birthday. But yeah, I'm transitioning out of my current position. I don't believe my program administrator is here today, but I'll re-enter her information. So it's definitely bittersweet. Thank you all for all the work and partnerships. I've really enjoyed my time here. So thank you, Lee, for the time to say a couple of words.
Well, great. We've really enjoyed working with you. You've taught us as much as you've learned. So we wish you all the best moving forward.
There you go, Taylor. You're doing okay?
Thank you.
Excellent. Thank you all. All right, Taylor, we're good to go.
I got about 10 minutes for you, Taylor.
Oh, happy Mental Awareness Month to me. So this month was kind of slow in terms of Westside participation. So we'll mostly focus from January to April. A lot of these samples are also due to COIP's participation, so I greatly appreciate that from them. As a whole, the whole program, at least roughly about 50% of the samples provided have been from the West Side. And of those samples, we can see over here kind of the breakdown of that. I'm gonna try and go a little quickly through this. We have sent off many of those samples for GCMS confirmation. I used to argue that it was the gold standard, but I want to back up on that a little bit. I do find it extremely relevant and helpful, but using reagents and FTIR, we are able to make a difference as well. With that being said, there are many elements within the Chicago supply that are so minute that GCMS does really assist with identifying what is going on there. I will briefly kind of just show some of the benzodiazepines that we are coming across, in addition to some pressed ecstasy tablets. The clonazepam as well as the bromazepam we've been seeing quite frequently in both white pressed pills in addition to the green ones. Recently, we also saw a blue one that tested positive for benzodiazepine, negative for fentanyl. We're waiting on confirmation on what that active agent may be, but my best guess would be flurazepam as well as atizolam. We're also seeing some cathinones crop up, but I will kind of skip over that. That hasn't affected the West Side as much. We've maybe seen it twice in a few samples acquired during raves. Over here is more of an example of what we're seeing in the dope supply, a continuation of how it was starting around the beginning of the year. We have occasionally a heroin sample. I've maybe seen 3 since the beginning of the year, so that is unfortunate, especially when a lot of this has been sold as heroin, but it ends up being 4-fluorofentanyl, fentanyl, diphenhydramine, Seroquel, acetylfentanyl, and then fentanyl byproducts and xylazine, unfortunately.
Sterilization is completed.
Since 2020, we've roughly been seeing an increase in xylazine, and from like 2021 to presently, typically we see more xylazine in the samples. However, it is still falling below the detectable threshold with our FTIRs. But it does seem to be at many times on par with the same mixture percent as the fentanyl itself. We're also seeing some unidentified substances in addition to the nitazines, which are an opiate compound, unlike fentanyl or heroin. They are completely synthetic. They originally cropped up to help bypass urinalysis for those who were getting drug tested, who still wanted to try and treat their pain and other issues on their own. So policing that, participants will always find a way around. And for the final slide, kind of just bringing up the fact that Seroquel has started to crop back up in the supply. Initially, it had kind of disappeared for a few months. We saw a lot of it in 2021. It does appear to be making a comeback. And in my personal opinion, it seems to be typically in lieu of benzodiazepines, similar in the dope supply in other city centers. Chicago very much seems to have a unique dope mixture, which I find kind of interesting. There have been reports of it being traded elsewhere, like the flow of substances out of Chicago into surrounding cities in Illinois. But I do look forward to greater participation with more agencies, and I look forward to us working on the bans with both the Night Ministry and hopefully in the future POIP as well. I do feel like the more participation we get, the better idea we have of what's going on. And another thing that I would like to mention, we come July are hoping to set up a training program for reagents for those interested in having that skill set on hand. FTIRs are brilliant, but the accessibility is small. The cost is sometimes high. And when you order the machine, it can still take 3 to 6 months. So to kind of offset that delay with the programs that we see beginning to participate in this end of harm reduction, we hope to still be able to tackle and give immediate results to participants on location using both reagents and other sort of testing strips. We will also be ordering some testing strips similar to fentanyl test strips that will check for Seroquel and a few other components. And I think also in July, CRA itself is going to start doing a town hall that will go more into depth of not only the West Side's drug supply, but various other city center drug supplies, both in Chicago, down in Springfield, and also out of state. Yeah, that's pretty much it for today. If there are any questions, please feel free to ask.
Wonderful, thank you.
There was a question from Derek O'Neill about whether or not you would share these slides.
Yes, I saw that.
Of course, more than happy.
Get them over to us and we'll include them in our follow-up. Wonderful.
Any other questions for Taylor?
Not that I'm seeing, and I'm not seeing any hands up. Great, Taylor, thank you much.
Thank you. And, I think that's a great idea to have your own, dinner with Taylor show so that we can really get some, ongoing information. Of course, we're very Chicago and West Side centric, so don't get too far afield. We'll try to keep you close
Bring you
close
in.
by. Yeah, exactly.
Hey, Taylor, you can stop sharing your screen. Thank you so much.
I hope.
I think it's an option. There you go.
There you go.
All righty, we're good.
So we have 10 minutes to go. We can kind of say, hey, we did a great job. We stayed under the time, or we have any other announcements or insight from anybody?
We could all sing happy birthday to Lee.
No.
Look, he won't let us. Brian asked, do we need to pre-register for the Healing Our Village event?
Dee Dee?
That's Dee Dee Osborne's event, yeah.
We'll make sure. She may be running to her
Yeah,
flight, but we'll check in with her that way.
Okay.
Where's the party, Lee? Lou wanted to know where the party is.
Mhm.
It's in my mind.
Yeah, it's a good place.
I think that's a Talking Heads line. There's a party in my mind. I hope it never stops. Anyway, I don't want to give you TMI there. All right.
Peter,
So
do you have your hand up there?
Yeah, I did. Thanks.
Okay.
Just wanted to piggyback on what Taylor mentioned about we've been finding where since a lot of the media has been focusing more national and local media on this epidemic that we're all taking part in meeting, and as Lee's been, the leadership on this for years now, is we found that we had these kits for overdose kits that were syringes. They weren't the spray canisters, and we saw them rapidly leaving our facility on Roosevelt Road. And I mean, so there's, we're not advertising those. Those are just in a little room and people come by, to check in our lobby. And it's not a high volume lobby where we have dozens or hundreds of people. Some days are dozens and some far fewer. So what's nice to know is word of mouth and so forth, people are really looking at this. And I thought that should be mentioned. We had such a substantial supply of these naloxone kits that were both the spray and the syringes that were made. But these syringes just literally flew out the door. Over the last 3 months or so, 57 kits went outside of our door. And of course, we all know the more hands that are on those, the better, as Dr. Jasmine mentioned as well. And also the information you mentioned about that xylazine, that just scares the hell out of me. I just wanted to say that because that's like, oh my gosh, this too. So, but anyway, thanks and happy birthday, Lee.
thank you very much. Thank
Looks
you.
like we got a hand up by Vana, and we got about 7 more minutes left. So happy to take you, Vana.
Thank you. I'll make this really, really quick. It's just an announcement. We all know that there's been a huge need for women's recovery homes since the Women's Treatment Center closed. And I am happy to announce that Phoenix will be expanding our program to include 30 beds for women as of July 1st. So we're super excited
Wow.
about that.
What a great announcement. Fantastic.
Vana, congratulations.
Really incredible. Congratulations, Vana.
That's
long
awesome.
time, long, hard work coming.
And Vana, having you here, it makes me always think about our fentanyl work group. And I think that we probably should revisit and see if we can maybe pull Taylor and others who are interested in this to continue to refine our work and kind of revisit, the way the system may be in sync with this in terms of testing and making sure that we have a clear path for people who need that support, no matter where it is. So we'll revisit that together.
Absolutely. I agree.
Yeah, great. Thanks. All right, everybody. Fantastic to be with you. We'll see what we can do for having a live meeting where we can kind of hug and tap toes and really get to know each other in a way that these Zoom meetings just don't allow. So take care, everybody. Have a good one. And thanks again for all the nice wishes. Appreciate it.
Thank you all so much. We'll be sending out follow-up at the end of the week. Be on the lookout.
All right. Thank you.
Thanks, Matt.
And happy birthday.
Appreciate it. Thanks to all. Hey, thanks, Brian. You want to stay on for a minute there, B?
Oh, for sure. Just want to recap. Thanks, Elizabeth. Thanks, Brian. Guys, enjoy your week.
Big hugs, Brianna.
Get well soon, Al. How you doing there? Still there? Signing off.
Do you have the participant? Can we save participants or no?
Save participants?
Can we know who all our
TV,
participants?
Veronica,
Yeah.
stop your recording.
Oh, stop
Stop your-
recording.